Hi, I'm Dr. Morgan Massingale, a physician here at Ethos Integrative Medicine. In this video, we'll be going over endocrine disruptors, where we find them, and how to avoid them, and why to avoid them. So the most common endocrine disruptor that we come across in our lives is plastic and plasticizers. And it's found in a variety of forms. It can be really confusing to really understand what plastics, if any, are safe and what use case scenarios they're safe. And so this kind of series of videos that you can dive into will really help you identify those things, understand why you're avoiding these plastics, and help you do that effectively and cost effectively in your life. So what is an endocrine disruptor? An endocrine disruptor is anything that mimics a hormone or affects the way that you metabolize a hormone. And why is this a problem? So we come into contact with a lot of things in our day-to-day lives, and if it's affecting the way that you're either processing or able to utilize your hormones, it really makes your treatment plan less effective because we are, adding in another variable or another layer of issues. Now, where do we find hormone disruptors? The most common place is plastics. So we may be coming into contact with plastics and not even realizing it. It's more than just the plastic soda bottle that you recognize as plastic, right? It's the phthalates and parabens that are added in as fragrances to our cosmetics, our cleaning products, the plastic liner of the paper cup on your daily Starbucks run, right? So let's dive into plasticizers. There are actually 7 different types of plasticizers on the market. And you can actually tell what type of plasticizer a plastic is made of by that little recycling looking symbol on the bottom of a plastic. It has a number on the inside. Now, if you're like me, growing up, you may have come across information that said that was the number of times that it had been recycled or some such nonsense. That is false. It is actually identifying what plasticizers have been used to make that product. Now, the number 1 inside of that little triangle stands for PETE or PET, which is a polyethylene terephthalate. Don't try to say that 3 times fast. This makes our normal plastic bottles, so those soda bottles, dressing bottles, water bottles, microwavable food trays, that sort of thing. They're usually not reusable because they absorb bacteria, they absorb odors, that sort of thing. A lot of times we'll use that once, throw it in the recycling bin, never think about it again. Number 2 is a high density polyethylene. This is actually found in a lot of household cleaner bottles and shampoo bottles. It makes that thicker, non-translucent plastic that you think of. Number 3 is PVC or polyvinyl chloride. This is one that you want to kind of put in the memory bank. Number 3 is especially one that you want to consider avoiding. You're going to find these in a lot of cooking oil bottles, clear food packaging, and it contains phthalates, which really are hormone disruptors. Number 4 is a low density polyethylene. A lot of times you'll find these in those thin plastic bags, right? So it's not necessarily coming into contact with your mouth, hopefully, or with your food directly. So these are a lot less of a concern. Number 5 is a polypropylene. Ketchup bottles, strong, rigid fiber plastics is what's typically made out of number 5. That actually includes drinking straws, which I know have become out of vogue, but really we should be avoiding those anyway to save the turtles. Number 6 is polystyrene. So a lot of this is, you're gonna think of as those styrofoam cups. These are not recyclable. They leach styrene into your food, especially when they are microwaved or heated. Number 6 is another memory bank one. You're gonna wanna avoid these. Number 7 is our catch-all miscellaneous other category. It's also one that we want to put in memory banks as a avoid. This is where we commonly find BPA. A lot of information has come out about BPA and how it is carcinogenic. And so a lot of times it'll be marked as a number 7 and be marked BPA free. Don't be fooled. We have just kind of modified that BPA molecule at this point, and it's now BPC, BPE, just slightly modified BPA. There are not a lot of studies to show that they are toxic necessarily, but there are also no studies to show that they are safe. So we're going to go ahead and keep number 7 on our avoid list. Just to reiterate, the unsafe numbers in those little recycle symbols on the bottom of your plastics are 3, 6, and 7. If you're going to kind of prioritize what you're avoiding, those are the top ones. A subcategory that we talked about in that number 3 plastic is a phthalate. What is a phthalate? Well, it's an additive to plastics that makes it more flexible and more durable. That's why we use phthalates. Unfortunately, it does very strongly affect the endocrine system because it attaches to the estrogen receptor. So it can actually increase high estrogen type symptoms without actually there being high estrogen in the body. So it can be really difficult to work with, because we test your hormones, we see that your estrogen is in a normal level, but you're still having symptoms of high estrogen, right? So removing these types of plastics in that case can really help with those types of symptoms. The most common place that you come into contact with phthalates is in the diet. That is the highest potential. So foods heated in plastic containers, children putting toys in their mouths, especially plastic toys. Enteric coated meds, so medications that have a coating on them to get them through the stomach and into the small intestines, actually have a little bit of phthalate on them. So if you're taking a number of medications with that enteric coating, that tolerance kind of just builds up over time. The next place that we find exposure to phthalates is in skincare products. There are a lot of phthalates added to moisturizers, shampoos, insect repellents, fragrances, that sort of thing. And the last place that we're going to find that is in our indoor air. Phthalates is a lot of times sneakily hidden in a label as fragrance, right? Fragrance is the dirty catch-all that really gets a lot of things by consumers, usually on packaging labels. We see fragrance, we think, oh, it smells nice. We don't think phthalate and endocrine disruptor. So what problems do phthalates cause? The most sensitive population to phthalates is actually immature males, so young male children. It actually decreases long-term fertility for men. We have seen a decrease in fertility in men in the last 20 to 30 years. And there is a lot of research and a lot of thought that the exposure to plastics, especially as young people, has really decreased testicular function, which decreases testosterone levels, which decreases sperm count. So we have seen a decline in fertility in our general population, likely due to these high level of exposure to phthalates. The next thing we're going to talk about is BPA. We touched on that when we talked about that type 7 plastic. A lot of things now are labeled BPA free, but like I said, we've modified that BPA to be a BPC or a BPE, which is not BPA, but is not necessarily safe. Now, why is BPA a concern? It actually binds to the estrogen alpha receptor and acts as estrogen in the body, which can interfere with how you produce your natural estrogen. So it can actually depress your estrogen production. And it can also modify the way that your liver is able to process through the CYP pathways. So it can actually congest the liver, slow down your metabolism of anything else that you come into contact with. So your hormones, any toxins in your environment, any medications. The pharmacogenetics of medications are really strongly based on how well your liver processes out these medications. That's how they determine dosing and appropriate timing of dosing, that sort of thing. So if you're modifying those pathways, you may also need to be modifying the way that you're taking medications or your dosages of medications. And very importantly, it actually stimulates breast cancer growth. That is well researched in the literature. High levels of BPA are also associated with cardiovascular risks. So myocardial infarctions, heart attacks, angina, those sorts of things. The last thing that we're going to touch on in this increasingly scary video is parabens. So basics of parabens, where do we find them? This is very commonly found in cosmetics, things that you apply to your skin. And it's found in those products because it gives it that velvety feel. So if you have tried a bunch of different lotions and found, some that you like, some that you don't, they absorb well, they don't absorb well, they feel nice on your skin, they feel kind of tacky on your skin. A lot of times the ones that have that silky feel have high levels of parabens in them. So while it may be getting you that feel that you like in your cosmetic, it's not doing your hormones any long-term favors. The other reason that it's used in these products is that it does have a small antimicrobial effect. So it allows a longer shelf life for a lot of these products. You have a lotion you open and it's probably been in your cabinet for more than, 3 months, right? So potential for it to grow bacteria and that sort of thing is fairly high. So that antimicrobial activity of a paraben is another reason that it's added to these products. So what is the concern with parabens? It again has an estrogen-like action in the body. It potentiates breast cancers, it disrupts natural estrogen production, and it decreases fertility in both men and women. The majority of plasticizers, parabens, phthalates, BPA that you come into contact with are water soluble. So you're coming into contact with them, your liver is doing its best to get them out of your body and excrete them right away. Because of this, if you are seeing active excretion in the urine, you are actively coming into contact with these agents. They're not being stored long-term in the body. So really, when you're able to cut them out of your environment, you're able to process out these things fairly quickly. Some of the caveat items here are things like DDT, which thankfully are no longer used actively, but they do have really long staying power in the environment. DDT was an insecticide that was used. It discontinued use back in the 70s, but it is in the groundwater, it's in soil, and it is fat soluble. So it is stored in the fat cells of the body and released slowly over time. Those ones are not as easy to clear. So actively avoiding any exposure in your lifetime to DDT is very important. So that concludes our video about endocrine disruptors. There's a lot of information, so feel free to come back to this video library, rewatch that to refresh anything that you came across that you found interesting. Bring it up at your next appointment if you need any clarification on any of these things, or watch some of our subsequent videos to find out, okay, I understand that there are plasticizers in my shampoo. How do I avoid that, and how do I properly look at a label, and what are some safe alternatives that I may look into?